Well, hello everyone. I hope you are all having a great Tuesday. So today is our next Sit and Sip series session. And today we have a special guest, Erin Seavey. Is it Seavey? Is that how you say your name? Okay,
Yeah.
perfect. And so today, we're going to have her kind of talk a little bit about her role and ask her some questions here and there. But instead of me butchering her, trying to introduce her, I'm going to let Erin introduce herself, and then we'll kind of get started.
All right. Thank you. So, like she said, my name's Erin Seavey. I am a nurse, a registered nurse. I went to UMaine, graduated with a 4-year nursing degree there. I have a bachelor's in nursing, and I have worked in cardiology my whole career. I graduated from UMaine and went and worked at Eastern Maine Medical Center on the Grant 4 cardiac telemetry floor. And actually, after a year of working there, I got married and moved to Massachusetts. I worked in Worcester, Mass for a couple of years while my husband went to pharmacy school. It was kind of enlightening. I went from Little Bangor, Maine, which is what we think, to a big city. And I'll tell you that the hospital down there didn't have anything on Eastern Maine. Not like outing Eastern Maine Medical Center right now, but I did gain some experience there, but that I didn't have here just because of where I ended up working. I worked with patients that got peritoneal dialysis. We were the floor that did that. If anyone knows what that is, it's, there's hemodialysis, but peritoneal dialysis they can actually do at home themselves. And we would have patients that would come in that do that they would have an illness of some kind, and we would do their dialysis for them as well. You need special training for it. And I took care of patients that were stable on ventilators if they had like a chronic illness or a condition like a quadriplegic that has a trait that they need a ventilator to help them breathe. We would get patients like that. And we did some cardiac telemetry as well, not as intensely as I did at Eastern Maine. And after my husband was done school, we came back and I worked at Eastern Maine again and back on the cardiac floor. This was home. We liked it here. And we're lucky to have a trauma center like we have in Bangor. I was happy to come back. And I worked there until I was approached with a job. I was working part-time because we had 2 kids in this period of time. And I'd been a nurse for, I think, 8 years. And I was approached with a position by a nurse practitioner that I had worked with, who had worked with the cardiology group. And it was a position in the cardiac research center that they have at the cardiology office. And I knew nothing about it. And I had seen one presentation at the hospital from someone from this group talking about research studies that they did. And she said, it's a part-time position. Why don't you come and check it out? Because we are familiar with you there. It's nurses that have worked at the hospital. They know what kind of work you do. And quite honestly, it was very flattering. You don't get offered jobs from, people that often, it was very flattering. So I looked into it and thought, this is kind of neat. Research is what's up and coming. And I liked education. I liked school. I did well in school. I always did. And I like the process of learning. And as a nurse, you are always learning, but you also you're learning new things that are coming and stuff, but not in the capacity that you do in the job, like I do in the job now. This is kind of cutting edge stuff. It's what's coming. It's what medicine is moving towards. And I'm fortunate in the job that I work, the physician that we work with mostly, he is actually maybe towards the end of his career. Well, he is. I think he's in his 60s, but he's very forward thinking as well. So it's kind of, I like being in that side of medicine, seeing kind of what things are coming. So yeah, that's what I've done for my career. I've been in the position I'm in now since 2011.
Wow,
So
that's awesome.
yeah, time's flown kind of.
Yeah, that was a great little like journey through your career.
Yeah,
Little
all cardiology.
you.
It's what I've been interested in.
Yeah, that's awesome. What got you interested in the cardiology side of nursing in the first place?
Honestly, it was one of the professors at UMaine, Ann Sasong,
Mhm.
one of my professors there, and she had always focused in cardiology in her career. It was kind of her thing, and she was passionate about it. And I just kind of caught the bug from her. I think, honestly, I I don't know. I was kind of honestly drawn to it. I think everybody kind of has that thing that they're interested in. I was never interested in oncology really.
Mhm.
And a lot of people think like pediatrics would be fun or, interesting. I'll tell you, my pediatric rotation, it was fine. It's very enlightening to see, what these kids are going through. The
Mhm.
hardest part was dealing with the parents. The parents are under so much stress,
Yeah.
and yeah, that part of it was hard. So, dealing with adult cardiac patients just really, I don't know, it was just what interests me.
That's awesome. So your rotations were a great kind of like look into what you would be experiencing and kind of helped you make your decision in terms of
Oh,
what.
yeah, I definitely, my rotations that I did, I had really great nurses that I worked with. So in the nurse that I did that was my preceptor at my senior year in college, she ended up orienting me when I got my job on that same floor. So
Oh,
yeah,
that's awesome.
she was awesome. Yeah.
That's really cool. Now, I know like you said that, clinical research, like, research in nursing is not necessarily something everybody knows about. Could you kind of maybe give us a little bit of an idea of what your day to day looks like in your role?
Mhm. Yeah. So I'm going to be totally upfront with you. It is not like super exciting. I say
That's
like,
okay.
oh, yeah, it's kind of a cool part of medicine. It's research. So when you're a nurse in the hospital, you work, 3 12-hour shifts, and your patients come and go quickly. Hopefully you take care of them, they get better over the course of a few days, they leave. You'll probably never see them again. And it's kind of unfortunate when you do. They're back in the hospital. I always used to say, I discharge somebody, I hope I never see you again. Don't take it the wrong way. But with what I'm doing now, we follow the same patients over years. So um, a lot of what I do is very stereotypical in terms of clinical research.
Mhm.
Um, we have these studies. So we're a pretty well established, sought after group. We do good work. I'm proud to say that. And it's not me just thinking what we do is good. The companies, we do industry sponsored trials, which are trials that we're paid by drug companies or companies that are making a certain product, and we're paid per patient. And I'm upfront with the patients about that, because they'll ask me sometimes, so what's in this for you guys? And I'll say, quite honestly, yeah, we're paid per patient. We have each study has a protocol, that's what it's called, is a study protocol, and it
Mhm.
tells us exactly what the study's about, what they're looking for, the criteria of the patients. Each study has inclusion criteria and exclusion criteria. The patients have to have certain conditions to a
Mhm.
certain extent, but they can't have other things. They don't want, like, most of the studies, they can't have cancer and bad livers and kidney issues and stuff. They don't want that kind of muddying the waters of what the drug or therapy is doing.
Mhm.
So these companies come to approach us through email and say, hey, we have this study. What do you guys think? Would you want to participate in it? And my boss, our director, and the physician that we work for, they look at it and say, you know, is this a study that makes sense? Does this medication look like it has, you know, merit that we would want to take part in? And we turn a lot of them down. But the ones that we take on, we then look in our patient population and see who would fit the criteria.
Mm-hmm.
Then call the patients and we ask them, you know, we have this study, or we see them in the hospital. Some of them are trials of people who are getting stents put in, like cardiac stents. Some of them involve pacemakers, new on pacemaker leads, or actual devices that do new different things. We approach the patient and we say, hey, this is the study we're doing. We have, it's all very ethical, it's very by the book. We have this pretty lengthy form, a document that's specific for each study that we
Mm-hmm.
go over with the patient. It's called the informed consent. And we go over that with them word for word and answer their questions. And if they agree to take part in the trial, they're all completely voluntary. We are sure to point that out. Then they sign on to taking part in the trial. Some of them include, you know, visits and follow up over the course of as short as 12 weeks. Most of our studies go on for a matter of years. And so that's kind of what I was getting at with in the hospital. Patients would come and go quickly. We
Right.
establish relationships with these people. It's really nice. And they become really comfortable with us. They come in with questions that they've been holding off on because they know us. We have
Mm-hmm.
like frequent contact with them, like every few months. They come and see us. You know, we kind of keep an eye out for them. It's an added bonus to being in these studies. Yeah, they bounce questions off us. I'm the least experienced nurse that works in our department. There's 5 of us. It's a department of 9,
Mm-hmm.
and I've been a nurse for how long? 17 years next month. So yeah, it's a pretty good resource for the patients. But during my day, we have some of our visits that we do with patients. We conduct over the phone.
Mm-hmm.
Um, we call them, ask them if they've had any like medical occurrences since we last spoke with them. We go over what medications they're on. Other visits include them coming into our office.
Mm-hmm.
We do vital signs. We run lab work. Go over the same questions. If it's you know, if they've had any issues like medical issues, we collect the study medication if there's some involved that they have left in the empty bottles, because we have to count to make sure that they've taken what they're supposed to take. And
Right.
you know, all of that stuff's kind of stereotypical. But other times we're in the hospital. I spend a lot of time in the cardiac cath lab. We're there watching cases, and there'll be new stents that we're trialing, and I have the study protocol in a book in front of me, and the cardiologist will be doing what they're doing, and they'll turn and look at me and say, okay, what do I do now? And I'm like, okay, let's see, and we'll talk about it. So yeah, I've had other trials where I've actually gone into the cath lab and had to push experimental medications during the case.
Mm-hmm.
um, you know, you have to get dressed in like sterile gown and lead and all that stuff because there's radiation. And so it's nice. I still have patient contact, but it's not as fast paced, which is good in a way.
Mm-hmm.
I'm not dealing with life and death every day.
Yeah.
Um, yeah. So, you know, in the hospital, cardiac floor especially, things can go bad really fast. And
Right.
I don't deal with that so much anymore. We still respond to emergencies in the cardiology office. So this is kind of a nice mix between like patient care and, you know, like I said, scholarly research sort of.
Yeah. That's awesome. That's really cool that that's even a career path that somebody could
Mhm.
even look into, especially if they don't want what you had before, the more high intensity, but they still want that patient interaction. That's so
Yeah.
cool.
And there's stuff that I miss from working in the hospital, you know. It's a very intimate thing to be involved with a patient. And one thing I would always remember, and that I would tell, you know, new nurses or students that I would work with, I worked with them a lot, was, you know, sometimes these patients are rotten to you. They really are. And you have to remember, I've been so fortunate in my life. I've only been in the hospital twice, and it was to have my children. You
Mm-hmm.
know, these people are maybe having the worst day of their life. Like
Yeah.
really, they really are. And the men especially lash out when they're scared.
Yeah.
So it's something you got to keep in mind. What is behind this? You walk in the room and the patient suddenly goes, this is how it's going to be, and that's why. And
Mm.
it's like, whoa, okay. They feel totally out of control. They are terrified. You look
Right.
at them and I learned to just look at that and say, oh my God, he is so scared. So
Mm-hmm.
yeah,
That's a really great point.
I miss making those connections with people, but like I said, I make connections in a different way, and it's for long term.
Yeah.
When studies end, because they do end, some of them kind of panic. They're like, well, what am I going to do now? I'm not going to come and see you guys anymore. And we're like, we'll see if we can find another one for you. So they get to the contact.
Oh, that's awesome. That's really cool. Great. So my next question is, how has COVID-19, this whole pandemic and everything, how has that been affecting your role? Or, if it hasn't been having a huge impact, what is your perspective on this whole, the pandemic and what's going on in healthcare right now?
Well, it is, I think really obvious to a lot of people that what's going on right now is pushing us to develop things that we kind of knew were possible, but weren't taking the time to maybe really dive into.
Mm-hmm.
Um, I know we haven't been performing like telehealth visits, like Skype visits with our research patients. We're not seeing any of our patients in our office now.
Right.
We're doing it over the phone. So we're modifying our protocols,
Okay.
which typically you do not do. If you do, it's called a protocol deviation, because these studies have to show the FDA that their study was conducted in a certain way. And if you
Mm-hmm.
deviate from that protocol that the FDA has approved, everything in research is legalities.
Yeah.
Everything. I have learned to just think of everything 10 times in 10 different directions, because however I interpret something, I have to think of how everyone else might interpret it too.
Right.
It's a little nerve-wracking in that respect. So we're deviating from our protocols a lot. And a lot of the time it's at the advice of the company that made the protocol. So we're not, with medicine, you have to find a way to do things, but you can't compromise on safety at the same time. So with us, we are looking at every study we do in the medication that's involved with it, and trying to figure out the safest way to continue to conduct this research, because this research is important. Everything we have in medicine, every medication, every device, every procedure came about from researching it to make sure that it was the safest, best way to do it.
Yep.
So we are continuing our research studies, but like I said, we're conducting all of our visits over the phone. So we're not doing lab work. For a few of our studies, we have sent patients to have lab work done at like a local facility. Typically, they have to come in and we draw their blood and we send it off to what we call a centralized lab. It's a lab in Kansas City, Missouri or something, it's like a ways away, that the drug company has contracted and has, let them know exactly how they want these samples tested.
Mm-hmm.
So everything's done the same for every patient. So we've had to have people go to like local labs to have things done and just got the results. We've been doing curbside medication dispensation.
Oh, cool.
Still on the study drug. We do their visit over the phone, make sure that everything's going okay. They can continue taking the study medication. And then a little while later, they like drive by and call us and say, hey, I'm out front. And we go out and like give them their medication through the car window. I did that today. So yeah, I mean, just things like that. But a huge thing with research is everything we're doing that is different from usual, we have to document. We did this during COVID-19 because of this. And
Yeah.
because it is crazy. Personnel from the company, we call them the sponsor, the company
Mm-hmm.
that drug, they come in, look through our documentation, look like just to make sure we're doing everything by the book, by protocol, and that it's ethical.
Yeah.
They will come in 6 months and ask us, hey, I see you did this way. I'm confused. What was the scenario behind that? Well, we have hundreds of patients. We do thousands of visits every year.
Mm-hmm.
For us to remember 6 months ago, right now, it's obvious. In 6 months from now, when we look back, we look at this stuff and we're like, why did we do that? Like, so we have to document. So, we're doing that even more so in the midst of all of this. Yeah, we're really scrutinizing over our documentation. It's so important.
Yeah.
But yeah, it's finding a way to do everything that we need to get done. It's kind of challenging, but I think what we're going to see is like insurance companies, for example, have
Mm-hmm.
never reimbursed doctor's visits done over like Skype or whatever,
Right.
whatever medium you're using. They've never reimbursed them well. And it has, especially in a state like Maine,
Mm-hmm.
where there aren't a lot of cardiology offices. We have patients that drive down from Caribou to see our cardiologist.
Right.
They may not come down as often, and we don't do the telehealth visits because they're not reimbursed by insurance companies as well. Right now, insurance companies are reimbursing them like in an office visit because it's just what needs to happen.
Mm-hmm.
That may open a door for us where, not that we don't want to see people in the office, but when you have elderly patients that have to rely on their working children to get them there, it may open up some options. And also we are able to, in some circumstances, ship study medication to patients right now. That's never been available to us before because the drug companies were like, oh, that's too risky. Well, all of a sudden we're seeing that we can do it.
Yeah.
And I think, well, so stuff like that. I think our industry is being pushed along a little bit. So it's unfortunate that we needed this to push us, but
Right. But
so
this could help with access, which is
yeah,
obviously a huge issue in Maine, just Maine
absolutely.
specifically. And so that could be a silver lining. And if we're going to try to find one in all of this.
Yeah.
So that's a really great point too.
Yeah, I'm sure there was a time in like education where, educators would think like, oh my gosh, online classes, like that's so impersonal. And I have to
Right.
know like students and stuff. And now there's entire universities that's how they operate.
Yeah.
So, medicine's a little behind in that respect. I think
Mm-hmm.
there's a little bit of self-importance that they were trying to hold on to when, yeah, they, there is that like doctor-patient relationship, but sometimes you have to weigh the pros and cons of everything. So I think this
Of
may be
course.
like one a little bit.
Absolutely. Well, this has been like super interesting. I've learned so much during this entire thing. So
Oh,
I do have one more question for you.
yep.
And so, as a UMaine alum and as somebody who is in the health professions field, what advice would you give to our current pre-health students who are in the process of, preparing for a career in the healthcare industry, and how they can really get the best out of their undergraduate careers to prepare for that?
Sure. So with my husband and I both going to UMaine
Hmm.
and going into the medical fields, I was really lucky. You can't go wrong with nursing. It opened. I'm not saying that because I'm a nurse. There's so many opportunities in nursing.
Hmm.
Look at like the executives and stuff at Eastern Maine. There are so many nurses in positions that they worked up to. You can become a nurse practitioner. You can do what I do. You can be a nurse on the floor in a doctor's office. The opportunities are endless in nursing. So I think you can't go wrong with nursing, and we need them. We're desperate for them in this area right now,
Yeah.
especially.
Yeah.
You have to look at what you're going to do as a professional. Your education is where your profession starts.
Hmm.
You have to think of it in terms of if I were in college again, like now,
Hmm.
and I was, 18 again, I would talk to somebody Like if I thought, I really want to do something in a medical field, I would talk to somebody in it and say, where do you see things going? Like if you had to do it again, what would you do?
Hmm.
For instance, my husband's a pharmacist, and he became a pharmacist when it was a big thing to be a pharmacist. They really needed them.
Yeah.
They opened so many pharmacy schools around the country. They flooded the market.
Mhm.
Pharmacists are having a really hard time finding jobs now. And 12 years ago, we couldn't have imagined that.
Right.
So he did it at the right time, but he tells people, I would not maybe do that now. Example of what big to and how things have changed. So definitely we have time will tell, but go into what you are interested in, but you also have to think, obviously where are the jobs going to be, and the best way to find that is by talking to someone who's in it now. So
Awesome.
you may prepared me wonderfully. So yeah, I had a job before I graduated. It was awesome. How many people could say that?
I know, yeah, that is so great. And I
Yeah.
know they just graduated a lot of Ollie, I think the entire senior class of our nursing students early
Yep, I
for
just
help.
saw that. Yeah, so
Yeah.
I was really worried actually what was going to happen because with the clinical hours you need, and I know they
Right.
pulled all the nursing students out of the hospitals and stuff. I was
Yeah.
thinking they make them go another semester like that. That actually really worried me.
It was
So
worrying the students as well because we had a couple who were starting to come to the career center like, what do I do?
yeah,
So that's awesome for them.
yeah. So I don't know if that was helpful or not, but
That was
yeah.
super helpful. No, that was great. I 100% agree in terms of if you know what you want to get into, start talking to those individuals, start talking to those people because they'll be able to provide some really great insight with that. So it is officially 4:30. And so
Yeah.
I wanted to keep this as, the 30-minute thing. And so I greatly appreciate the great insight and information and everything that you were just talking about today. It was super informative and really cool. Had no idea that was even a thing. So that was awesome. So thank you for sharing that. Is there anything else that you wanted to, share or say before we end our session today?
Oh, maybe the best part of my job, not that I don't like working, but
Yeah.
nurses work day, nights, weekends, holidays, all of that, which is a really great option.
Yep.
I work 7:30 to 5, no weekends, no holidays. And so just to throw that in, when I became a nurse, I didn't know hours like that existed. So that's another awesome thing.
Wow, that's awesome. Especially because there's students who, want to go into healthcare but want to have a norm, be able to have that work-life balance.
Yeah.
And so that's
Yeah.
awesome. Good for
Yeah.
you.
So anyway, yeah, just that too.
Awesome. No, that was great. Thank you for including that. Well, thank you again so much for being our guest today. And I hope you have a great rest of your day.
Thank you. You too.
Thank you so much, Erin. Bye.
Yeah. Bye.